Subject is about skin care for the poor. I have no conflict of interest. The main source of the lecture is Topical Skin Therapies, an old book by Polano and August 1984. Fancy creams and preparations are available for most of skin diseases now, thanks to the billions of dollars spent on preparation of these products. But again, in poor countries, we still need to find some alternatives. In the next two slides, I'm going to show 15 of these available products. Number one, starch compressors still work in our poor countries, whether we prepare the starch in solution or use potato peels for miliaria, as it soothes the itching and it imbibes the humidity, the excess humidity. Alum, which is aluminum trichloride hexahydrate, available in all the antiperspirant solutions, is cheap and available in our countries over the shelf in herbal stores, and we just wet it and use it for hyperhidrosis. Rose water is astringent and drying for oily faces. Sodium bicarb, baking soda, salicylic acid, and urea can be used both in preparations or sodium bicarb baths for hyperkeratosis and for callosis and sometimes for warts. Speaking about warts, still we can prepare in our pharmacies formalin 5 to 10% in aqueous solution for mosaic plantar wart. It's very effective, and it's even more effective than most of the recent remedies available in the market. Podophyllin resin is cheap in our poor countries, prepared in the pharmacies, and we can use it in venereal warts, condyloma acuminata, and I can claim it's more effective than most of the new advanced technology treatments available in the market. Citric acid from lemon and orange peels and topical retinoids from the pharmacies are still cheap, and they are good for the face and plain warts, for the face cosmetics if I want to do some peeling, and for plain warts over the face. Saline, whether available in the bottle or home prepared, is still the best treatment for skin burns, irritations, ulcers, and dryness. Green tea and cucumber slices with this astringent effect are good for puffy eyes. Potassium permanganate and other drying antiseptic solutions like methylene blue and gentian violet are non-toxic, non-irritant, and they are antiseptic. They are very effective for oozing and infected skin lesions, whether the infection, by the way, we use it for the infection, whether bacterial or fungal. Tar, Vaseline, Heliotherapy. People seem to forget about the Jokerman Ingram techniques for the psoriasis, although in our sunny countries, in our poor countries, we can use them safely, effectively under medical supervision. In atopic eczema, if it is dry, then we use moisturizers. If it is wet, we use the drying antiseptic lotions. They are steroid saving, and they help reduce the infection and the irritation. Tincture iodine is still one of the most effective therapies for malathisia and dermatophytes. Cornstarch, talcum, maybe, and other powders with potassium permanganate can be used for cutaneous moniliasis, as dryness affects moniliasis negatively and it helps to clear the skin safely. Zinc oxide 15% in cold cream is still the best sunscreen available. It is effective against the whole spectrum of the ultraviolet and part of the visible light. Oil of bergamot in preparations made in our pharmacies still is available and is very effective in treatment of vitiligo with the sun. These are 15 available preparations easily made in our poor countries, and we can use them with other techniques to help the poor. Moisturizers are very important. Heliotherapy, we are sunny countries and we can use this, and other techniques I'm going to refer to just right. Moisturizers help reduce the scaling, the fissuring, and pruritus. They can be used during treatment or during remissions of the dermatoses that they work on. They are steroid sparing and they are safe. Moisturizers can be used in dry atopic dermatitis, in psoriasis vulgaris with heliotherapy, in steatotic dermatitis and senile xerosis, in wear and tear hand eczema. They can be used as sole treatment for senile pruritus, idiopathic diabetic pruritus, and self-perceived sensitive skin. A moisturizer typically is formed by emollient, which is an occlusive preparation, mainly oils, and a humectant, which imbibes water and should be always used with humectants. Emollients, we have a whole range of emollients available. Each country would have one of the emollients more available than the other and cheaper than the other. We can choose depending on the need of our country, depending on the availability in our country. Basically oils, and the plant oils are available and very cheap. For example, I can use olive oil as an occlusive emollient and use glycerol, which is an olive oil extract, as a humectant. Using glycerol and olive oil can do the effect in a poor community with minimum charge that I can get with fancy creams. Of course, fancy creams are easier to use, better tolerated, and does not need such precautions in using, adjusting the amount that you are going to put. But with poor people, you have to find other solutions. This is a heliotherapy machine from the first meeting of the European Society of Dermatologic History in Berlin. I respect this very much because in our sunny countries, people run away from the sun when it is a real remedy for many disorders. 80% of the vitamin D that we need in our bodies is provided by the sun exposure. We can use the sun for photo and photochemotherapy under medical supervision, and we can teach our patients. It's cheap, it's available, it's free, it's in their balconies or over the rooftops. We can use it for photodynamic therapy if we want, and we can even teach the patients to build up tolerance for sun if they have a photosensitive dermatitis. Adding emollients and moisturizers to psoriatic plaques before sun exposure will help the effect. With Soralen, we can add it 15 to 30 minutes before sun exposure, and we should be careful with the amount of exposure we are going to get. Teach the patient, and we get the effect, as the sun has the whole spectrum that is absorbed by the Soralen in different levels of the skin. For heliotherapy, we have to be careful with skin types 1, 2, and 3, but we can be more brave with skin types 4 and 5, which are more available in the sunny countries, in the poor countries. Others, simply tar preparations, tea compresses, chamomile, and aloe vera. And maybe tens of other preparations if we dig into the old books helping the poor and underdeveloped countries. And most important, drink water while it is still available and cheap. This is all about helping the poor. I hope this short presentation will open a path for more discussions, more extensive about each of the remedies I just presented in this short discussion. Thank you.